CLARINET study was published in the New England Journal of Medicine in 2014 with over 200 patients in it, and that showed that there was a clear benefit of Lanreotide versus as opposed to the placebo in that group of patients, not only having anti-tumor effect generally, but also in the subgroup analysis looking at patients with tumor burden of less than 25% of their liver involvement, and also even more for more than 25% of their liver still showed benefit of being on the Lanreotide autogel. And the other difference from the PROMID study was that it involved both grade 1 and grade 2 neuroendocrine tumors, grade 2 being up to a proliferation index in this study of up to 10%. And there was a clear benefit in that group. More recent data, which is the extension study from the CLARINET open label extension study, looked at Lanreotide and followed up the patients who were in the placebo arm, who crossed over to active Lanreotide, who when they had progressed on their placebo, and also gave data on those who had maintained on the Lanreotide long term, and also the placebo until they progressed. And in the open label extension study, the results showed that the median progression-free survival, which hadn't been reached in the original Lanreotide study due to its effectiveness, was around about 33 months PFS as opposed to 18 months in the placebo study. More importantly, in terms of the open label extension study, was that those patients who had progressed on the placebo and were switched over to active Lanreotide, those patients who had progressive disease then had a median progression-free survival of another 14 months, so demonstrating the anti-tumor effect of Lanreotide even in patients with confirmed progression.